blessings to all. Welcome to the Daily Medicine as we continue with our breast cancer series. Today we are going to inform you on a type of breast cancer that is rare and accounts for only 1 through 5% of all breast cancers. It's called inflammatory breast cancer. This breast cancer progresses rapidly, often in a matter of weeks or months. Compared to other breast cancers, inflammatory breast cancers tends to be diagnosed at younger ages and more common and diagnosed at younger ages in African American women than in white women. Please join us as we begin and share this with family and friends. Thank you. Yo, we live. Welcome to the Med Daily Medicine. I'm not here today. Tired, man. I'm tired. Been a long day. Welcome, ladies and gentlemen. Let's get into this thing like I told y'all earlier in the earlier post. We're gonna get into this inflammatory breast cancer. It's a rare thing, and it's really killing people quick when they get it. It's hard to detect. Um, I'm gonna turn this over to the doc because I'm about to run out of words. I'm so tired. I'm handling my end behind this on the scene, but behind the scene, and let the doc roll.
Man, hey, hi everybody. Dr. Mark Johnson, as always. So this is continuing our series on breast cancer, and I wanted to talk about inflammatory breast cancer, and then after that, I'm going to talk about some of the costs associated with just breast cancer in general that impacts a lot of folks. But inflammatory breast cancer, as you heard in the intro, and Nate's right, it accounts for less than 5% of all breast cancers. The problem with it, though, is that if you get it, your prognosis from the get is not the greatest compared to other forms of breast cancer caught early. Also, the quality of life with it is not great. Okay, and it's just because if we talk about cancers like breast cancer, prostate cancer, or other forms of breast cancer, they're slower. Okay, we're talking kind of insidious. Okay, we're talking months and months and months for a year plus. Okay, that somebody could be affected by this. Prostate cancer more so than breast cancer. Inflammatory breast cancer, when it's there, it's in hyperdrive. Okay, it's going. Okay, and we are talking like months, 2-3 months. You may have some serious spread to this breast cancer. But the problem with it is not only does it have a bad prognosis or a high chance of dying from it or having a bad quality of life from it, it's rare, so we don't see enough to do enough research on it. Okay, so the risk factors for it are kind of all over the place. Is there genetic links? Yes. Are there some genetic pools they've seen from like North Africa, the Mediterranean, things of that nature? Yes. But if we all know kind of the DNA of this part of the world, North Africa and South Europe or the Mediterranean, I mean, God, what would you say, Nate? About 60% of the people in this country probably have like a little speck of DNA from that part of the world. I mean,
Right.
So it's hard to say what are the risk factors like we did for the lobular or the ductal cancers. Okay.
Right.
And so inflammatory breast cancer, why is it called inflammatory? So y'all have heard me talk about that word inflammation. And it's basically saying the things that your body uses to repair itself. This cancer kicks those chemicals off in overdrive. And so, as opposed to the other cancers, one of the main symptoms of inflammatory breast cancer is pain. Why? Because the tumor secretes all these chemicals and it's starting to just invade tissue all over the place. And it tends to be at that top layer or almost near the top layer of the breast, which is your skin, and some of that, what we call subcutaneous fat, or that fat right under the skin. And so we have some pictures. So if you got children around, we're going to show some pictures of breast with this type of cancer. So this is your fair warning. So 5, 4, 3, 2, 1. Here we go. Nate, put up the picture number 1. I can't hear you. Can't hear you.
Got me?
Yep.
All right, this thing right here.
Oh, let's see. It doesn't want us to do this.
It don't want us to do this, man. It was just working.
That's Facebook. Yeah, it was. Everybody, I swear to you, it was just working.
There we go. Come on. We rolling.
All right. Okay, so this is a zoomed in version of a breast with the classic, what we call peau d'orange, which is skin of the orange or the orange peel. That's a classic physical exam look that you see with inflamed breast tissue. We learned in med school the way you do it is you have a woman lean forward as to put, so the weight of the breast is centered on the nipple going with gravity, and so that tissue that's in that orange peel look is so tight and inflamed that it's really not going to move, so it's going to look like a patch like that on exam. And so as you can see, usually you have very distinct pores, very open, tender to the touch, and that is a big symptom, is pain, as opposed to the other ones. There's a lot of pain associated with this. And if you can see it having some redness on it as well. And so you have to have that to really say you have inflammatory breast cancer. However, what the difficulty is with a lot of us in medicine is that presentation right there is similar to what we call cellulitis, or the infection and inflammation of the top layer of skin.
That's
So
what it looked like.
yeah,
That,
so a lot of times people will get antibiotics thinking that's just what we call, cellulitis, or specifically for the breast inflammation or mastitis. So one of the actual clinical tools to say, hey, this might be inflammatory breast cancer is, hey, I just saw you, I gave you antibiotics, but you're not doing any better. And so, whenever I see that in clinic, I actually will follow up with somebody pretty quick, like within 7 to 10 days, just to make sure that's better, whether it be a phone call or an actual physical exam where I can see actual reduction in that pody orange look or that inflammatory look. Okay. Now, this is where the family history comes as far as from a clinical standpoint is if I know you've got a history of breast cancer and you're under the age of 50, like you heard in the intro, that's usually a younger woman's form of breast cancer, and you have a presentation like that, my radar would be going off really, really, really hard at that point. And sometimes, and I've actually seen this 3 times in my short career thus far of this type of cancer. And one of them, I actually did the antibiotics, but I presumptively just went ahead and got a mammogram, which is the next step. And come to find out, she did have some suspicious lesions on the mammogram. But luckily, we caught it early. And then, like all cancers, you got to catch it early. And so, Nate, go to picture number 2, and we'll see a more defined look at it.
Bear with me.
We're good.
All right, let me see here. Lord have mercy. Stop. Picture two. There we go.
All right, so this is more zoomed out form of it. So usually you will see something like this, where it has that very inflamed look, very tender. Women will complain of constant pain, constant, discomfort despite what you do. Now, yet again, this looks like what we would call a mastitis, okay? And this is actually a pretty big layer of it. Now, sometimes you may get some abnormal discharge from the nipple. A lot of times it may be more bloody than actually like a milky discharge, like in some other forms of breast cancer. And so, yet again, the next step after you see something like this is getting a mammogram, getting an ultrasound, getting them to the appropriate medical professional who can handle this specific type of breast cancer. Like we said, this is a rapidly growing cancer, so you have to pounce on it quick because if you're delaying this by more than 3 to 6 months, you're really behind the eight ball because this thing goes and goes and goes. Now, as opposed to the other breast cancers where whenever they do surgeries they try to conserve breast tissue for cosmetic purposes, for comfort, etc. With inflammatory breast cancer, it kind of is in that group of diseases where we're like, you know what, we got to cut this out, period, the end. We can't leave any margin or room or risk for error, because the reoccurrence rate or the chance you can get it again is high compared to other breast cancers. So
Yeah.
that's why when we see this, we got to hit this hard because this thing is coming for you. Okay. I mean, we're talking if you had this for 6 months, that thing is probably spread well beyond your breast.
Right.
Okay. And we are talking about, hey, you may not make it.
So,
Okay.
so Doc,
Yeah.
given the fact that when most black women go to the doctor, and most black women, it's a high rate. I read somewhere that there's a high rate of black women that die um, in a hospital from pain, going there complaining about pain when they
Yeah.
pregnant and certain things. When this happened, since they don't take the black woman serious when they do go to the hospital, we need the women to be aggressive. The young and the young women to be aggressive when they go in there. If they got something that look like a little rash and they tell them it's a rash, tell them to check you for the cancer.
Yeah.
Right
Yeah.
off the bat, because you don't have that much time. And ladies, young ladies, if you start when you see something like that, go straight to the doctor.
Yeah. Yeah.
Don't take your youth for granted. This is a young lady's disease, a young black lady's disease.
Yeah, yeah, and
So,
that's a good point, Nate. And if we tell you follow up with us, come to us for a follow up to make sure, okay? Because we've got to make sure this is getting better. And it's good that you brought that up because we're seeing that because that's very dramatic pictures on a Caucasian skin tone. But Nate, show picture three to show it on a person of color because this is where we have to really differentiate, and this is where it gets a little difficult because not all of us present as red, okay? But pain and discomfort is real. And now look at that, it's you can see a little red, but the main thing is you see all that necrosis. Now this is pretty advanced, okay, but if you see the orange peel look to it, okay, I guarantee you at the beginning of this that was probably a little patch that looked like an orange peel, okay, and based on how on where some of the redness is, there's probably a lot of parts of that that probably wasn't that red, okay, But this is something that can happen. Yet again, this thing is turbocharged. It is eating away at parts of her breast, and that's what you're seeing at where her nipples should be, okay, and the areola. Look at that; it's just crusted over. It looks like somebody cut it and your body scabbed it over because that's inflammatory chemicals all in there. Okay, give me a picture of four, Nate. Yep, you muted again. Hey, Nate, you're muted again.
Oh, I ain't want y'all to hear me chewing that ice.
Oh.
I gotta have it chewing ice. Yeah, there we go.
Okay, so now look at this. This is a lot milder of a case, okay? But if a woman comes in complaining of pain and tenderness, because yet again, that is a hallmark symptom, okay, is pain and discomfort, redness, irritation feeling, right?
That looks like the beginning of it.
That looks like the beginning. And so that's where we as clinicians and then people in public need to be mindful of, okay, you can get that from weight gain and fat deposits or what we call cellulite. You can get that from that. But if there's pain, discomfort, and just that
Right,
distinct, almost perfect looking orange skin, like almost like it's in a perfect pattern,
right,
that cause for concern. Because could it be an infection? It could be, but it could be inflammatory breast cancer. And that's why I say always, and even to my fellow clinicians, follow up with patients with that. Okay. Especially if you're diagnosing it as cellulitis and you have no idea how that person
nah,
got cellulitis, follow up with that person pretty quick because this is
right,
a fast moving cancer that has a poor prognosis, much like all the other breast cancers. African American females are the ones who die the most. Okay.
right.
They die the most.
Young African American female.
Young, right. We're talking 50, 40, and younger. Okay.
Right,
So we're talking, late teens, 20s, 30s, and things like that.
right.
So it's not to
Young.
play with. Okay.
Yeah,
And predominantly black women get this cancer. Now, the other two we've been talking about, the ductal and the lobular, people of Caucasian descent typically get that more. But black women die from it more.
right.
Minority groups die from this stuff a lot more, and it's because of low access to health care, insurance issues, not really following up with docs and things of that nature. And so this is something not to play around with. Okay.
Hey, Doc. I want to clear them up. When you say orange skin, what he mean is, you know how orange actually looks, the fruit orange
Yes. Yeah.
with the little holes in them. That's what he mean by the orange skin itself.
Yeah. So when
You
you
know
hear
what I'm saying?
potent orange changes, we're talking that literally just means the peel of an orange, the
Right.
actual fruit. So
It looks
thank you for
just like
clarifying that. Yeah, we're comparing it to a fruit, and the person who discovered this, that's what he thought. He was like, that looks like an orange peel, and that's
is,
where it got the name from.
is that his name, De Boer or whatever?
I don't even remember his name. So yeah.
I saw the beginning of it. Yeah.
And so and so we've talked about all these cancers and how they affect people and their families and stuff, but we need to really put in perspective how much this stuff economically impacts a normal family. And so we're talking about people who make a good bit of money. We're talking about middle class folks. We're talking about lower class folks. Okay, and so I'm just going to read some stats from 2015, okay, about the average cost of the first year of breast cancer treatment and then the average cost the next year, okay? And you're going to see the importance on actually going to your doctor regularly because the sooner we catch this stuff, the cheaper it is, okay? And
Right.
so what I'm putting in here, I'm counting surgeries, chemotherapies, radiation, doctor visits, meds, all that, okay? And this is if you have insurance. Keep that in mind. This is based on insurance claims. Okay. So if you've got a stage zero or really, really, really early, the first year, the average cost is $60,000. Okay. The next year, it's at about 13,000. Okay.
Now
If
this is for this cancer,
No, this is just for breast
breast
cancer in
cancer
general.
period.
Yeah, period. Okay. And so that's if you catch it really, really early. If it's a good sized tumor, but it's kind of caught still just in the breast, maybe one lymph node. So that's stage 1, 2 breast cancer. The average cost the first year is $82,000. The next year is $18,000.
You
Now,
talking about after insurance?
hmm?
This is what
this
the
is yeah, this is what the insurance is paying. So this is a good
oh
indication about how much this stuff costs. So imagine if you
right
didn't have insurance.
right
Okay. And
man.
mind you, this is 2015. So the dollar is not getting more valuable. It's actually
No,
decreasing
really
value
not.
as time goes on. So, guys, these are increasing as we speak. Okay. Now, if you've got an extensive cancer that is in a bunch of lymph nodes, maybe at one organ, or is at stage 4, where it's kind of metastatic, going everywhere, the average cost is usually greater than $120,000. Okay. Now, remember, this is just based on insurance claims.
Right.
Okay. The next year is $35,000 if you've got advanced breast disease. So, if you can imagine having insurance pay that, now imagine your deductible and then the stuff the insurance won't cover. We're talking thousands of dollars. We've got a lot of women in the workforce who are underpaid,
Right.
and now a family of one parent or two parents with a kid or two or three or four has to load that debt right there, putting you further in debt. And so if you think about the numbers, and all people, all adults who've got bills, y'all are really thinking about that now. Even with insurance, this can be a taxing disease. If you don't have insurance, say you're an independent contractor, say you are affected by this pandemic and you lost your job, okay, and now you get breast cancer. All of a sudden, you're in the hole 60, 80, 120, 150K, and that's just the first year. The first year.
A lot of my coworkers, man. A lot of my
Yeah,
female coworkers,
yeah. And
independent.
and I will, and just to go outside of that, you can say the same for prostate cancer. I remember in the late 2000s, when I was in med school, when I believe somebody got a Whipple procedure, you get like or like a transplant of a liver or anything like that. You were talking millions of dollars in the
Yeah.
first year of treatment. Okay, millions.
Mine was like 300,000, and that was in '89. That was
Yeah,
like no, that was like 94 the transplant.
yeah.
I still
So
got that bill out there in my shed out here.
yeah, and that's insane. That's
Yeah.
insane. So, I speak to everybody as an independent citizen, but this is one of those reasons why I believe in universal health care. We can debate about the schematics of it and everything like that, but I work at an HIV clinic. We have a thing called the Ryan White grant where we can take care of a lot of healthcare needs for homeless or low income patients. Okay. I feel that, especially the middle class, if you get a disastrous disease like a cancer that really has nothing to do with you, you just either lost a genetic lottery or you were exposed to stuff at work, this stuff should be covered. I think we can all come together and say, look, if somebody has cancer, if they're a little baby to somebody who's 80 and they want to be treated, let's treat them.
Dignity, man.
Dignity, right? And let's not have the middle class saddled by debt. Okay.
Right.
Now I
Uh,
see a question on there.
so This is our cousin Anita.
Yeah. Is that a
She's
boil?
talking about that. Yeah, that nipple on there. Let me see. Can I pull it back up?
Which one?
I'm finna pull it back up. I guess. Let me see this right here, because this one was up when she said it. Is
That one.
that the one? Is that the one, Anita? No, she ain't even watching no more. No, yes, she is. Can you hear me? Yeah, I'm on the mic. Yeah, she thought that was a boil. No, that's a nipple.
Yeah.
I
No,
mean,
that's breast tissue.
that's a
Yeah.
breast tissue. Yeah, I see.
Yeah.
Now get Facebook jail after this show, man.
No.
And we try to show y'all some healthy. I mean, some saving your life stuff, man.
But yet again, that goes into
Nah, she said that ain't the one. Let me see.
was it the first one?
Yeah, it gotta be the first. I'm gonna put it back up so she can so you can tell her what she's talking about. Gotta be this one.
Oh, right there.
Nah,
So I will tell you, before that looked all necrotic and things of that nature. If it had a head and things like that, if it was red and swollen in clinic, I may think that that may be a boil or a abscess under the tissue, or maybe like a mastitis or a cellulitis. But if I saw that, that's cancer till proven otherwise.
right.
Yeah,
I mean, you got to take it like that as a doctor and as a person. I mean, a regular a patient. You
yeah,
know, look how swollen it is all up there from the top of it. You can just see how the skin separate regular skin
yeah.
from where the swelling starts.
And that's the thing with
Wow,
the
that's
if
crazy.
if a woman doesn't get this looked at right, and it's inflammatory breast cancer, that all that tissue is gonna die. I mean, it's gonna look like gangrene, amongst
Right,
the whole breast. So there's been very, very sad and advanced cases of this that look just horrifying. Okay. So yeah, and does sometimes this stuff get called mastitis or
damn.
just, oh, you getting attacked?
Hey, I feel like that newscast. Remember that black dude trying to do
Yes.
that newscast? Motherfucker.
Hold that ass
That's all I just felt. That was a bumblebee, man. I got stung before. Don't feel good, man.
down.
You know, take my butt back to the house next time. Yeah. Excuse me.
But yeah, so just women, be mindful of your body, especially your breast. If there's something that drastically changes and you can't really explain it, go to your doctor, go to an OBGYN, go to a primary care provider, and just ask. Be like, hey, this is weird and this is uncomfortable. What's going on? Should I be worried? And these are the questions you got to ask. And yet again, the earlier you treat this stuff, one, the better your outcome is, the better your quality of life. But then two, it costs less too. Okay.
Right.
And yet again, if we'd all just get together, put in our own cents and stuff like that, all this stuff should be covered if you've got this type of cancer, etc. You know, because even with this, even when you hear that you have cancer, the mental toll that takes on women and their families is tremendous. It's astronomically high. And so mental health would be something else I would add into that. And so, just take it from somebody who treats patients from all over the spectrum, being able to prescribe meds and give the proper treatment to whoever without worrying about this insurance or they don't have insurance is so much easier and better for everybody. So, what if you have a cyst or a boil that keeps coming back, or and your mammogram is good? What should you do? So, at that point, if your mammogram is good, if everything is okay, and you have a cyst or a boil, one, you need to your doctor needs to sit down with you. and even if it's in the same spot, and reevaluate what this might be. Could it be a chronically clogged cyst or a gland within your breast? Could it be something with the bra you're wearing that you're getting irritation and microcuts, so it's always feeding an infection from that natural um, bacterial layer you have on your skin, no matter what you do? So there's and are there products or some kind of skincare product or any kind of household item that could be irritating your skin overall? And maybe this is more of an allergic reaction and it may be associated with other stuff. So there's a lot of other things this could be. And so that would be a conversation you would have to have with your doctor. Okay. Because that could, if it's not cancer, good, great. If it's not just a superficial infection, it just keeps coming back, then then you have to, as a clinician, we just have to talk about other possibilities.
I'm laughing. I'm laughing because I just thought you said you got to talk to your doctor. She's probably talking about you right now because I know this woman personally.
Right.
Yeah, you left. Left, damn it. I already know. You already know. Talk to my doctor. You left.
Right. Gotta get another.
I know she cracking up right now. Yeah. We got to start getting these breasts healthy, man. It's expensive, man. And I'm like, hey, we all grown folks. You see the sign up there say parental advisory.
Yes.
I'm a breast man. You know what I'm saying? And your men, most men are. I never seen a man to say I don't like breasts. So we have to start watching our women's breasts. Instead of just ignoring, you got to pay attention to your woman if you want her to be around. I say this all the time. I want to be with my wife until we get old. We already old, but 80s and 90s, you know.
Yeah, you're talking about golden age. That's where you
yeah, shitting on ourselves and shit, man. You know. Oh, baby, was that you?
Change your depends.
Laugh real hard. Just get diarrhea every day. Oh, well, man. But yeah, man, take care of your women, man, because they don't pay attention a lot, you know. They don't see the things we see, you know.
Right.
They on, we're on the outside looking at them. We can see it better, you know.
And I will say, we've done a few lectures on breast cancer. Yet again, bringing more awareness to it. It is October, but don't forget, next month is Men's Health Month in November. So I think it's No Shave November in honor of that. So we go from women to men, and you just see there's a lot of things that can happen with this thing we call the human body, and we just gotta take care of each other, okay? Pay attention to one another and try to get through this.
Yeah, I read. I know we're probably gonna cover this a little bit in next month. Men can catch this too.
Yes, and we will do this. Now, yet again, that is rare, but it does.
Right.
I know, right? I know, right?
Man, I don't even want to know, man. I'm just joking, man. Go get checked out. Don't be like, you're scared. Yeah, oh man.
That might be times where you're gonna be like, man, that thing needs to come off. I don't know.
Right. Yeah, no, that's crazy, man. That is crazy. What else we got, Doc?
Well,
before we embarrass ourselves some more. Too late.
But that's all I got today.
That's how this cancer is. It quickly can be explained. It can quickly take your ass out. So go get checked out, man. It's not much to it to talk about, but it can take you out. But we'll be talking about you real good for one day. So please, ladies, especially my sisters, man, because I love y'all dearly, man. Please take care of them breasts, man. I mean that from the bottom of my heart. Y'all take care. This been a daily medicine. Peace.